Hi, my name is Dr. Josh Cohen. I'm a board-certified ophthalmologist here at Cohen Laser Vision Center in Boca Raton, Florida. If you're considering refractive surgery, there are some things that you really need to know before you go in for your evaluation that will not only help you, but also help the doctor make a determination as to whether or not refractive surgery is even a good idea. The first thing is your prescription needs to be stable to make sure that the overall power of your glasses or contacts is the same over time. This is because if you undergo surgery, it's a permanent fix, so we want to make sure that we are not hitting a moving target. So therefore, it's important to come into your visit with not only any current glasses or contacts that you currently have, but any old prescriptions are really helpful to make sure that things are stable. If you can get records from other eye doctors, any previous prescriptions, that really does help. The second criteria is that you have to make sure that your body is overall healthy enough for surgery. Certain autoimmune conditions can cause the cornea to scar abnormally or not heal properly after refractive surgery. Common autoimmune conditions that are considered contraindications would be lupus or rheumatoid arthritis. Even poorly controlled diabetes is something that we also have to be aware of, and therefore it's important to consider that and know that that might be an issue before you undergo refractive surgery. Other autoimmune conditions like even ulcerative colitis or Crohn's disease can really impact your eye's ability to heal after surgery, so if you have those conditions, it might be best to stay away. However, if these conditions are under control and your symptoms have been stable for quite a period of time, then there may be some alternatives that your doctor can recommend. The other important consideration is if you are pregnant or planning to be pregnant or nursing within about 6 months of surgery, it's also a good idea to hold off. That's because hormonal changes within the eye can affect the prescription power and the lens power specifically, and therefore, again, you might be dealing with a moving target situation where in and around the time of pregnancy or delivery, your prescription is fluctuating too much for the surgery to be safe in your case. Another concern about refractive surgery, particularly LASIK, is dry eye. If you are using drops regularly or have contact lens intolerance, then sometimes LASIK might exacerbate those symptoms. Up to half the patients can experience some dry eye within the first year, and a reasonable percentage, it varies by study, but anywhere between 5 and 20% of patients can experience some long-term exacerbation of dry eye symptoms, so that's important to note too. The thoroughness of your exam with your doctor or surgeon will tell you whether or not he or she feels that you might be at risk for worsening dry eye conditions. Being aware of dry eye symptoms and treatments before you get your measurements in surgery is really helpful and generally result in a more accurate treatment. And the other thing to be aware of is that if you are coming in for measurements for surgery, we recommend that you stay out of contacts for several weeks to make sure that the cornea is not affected by the contact lenses themselves. If you happen to have a soft contact without any astigmatism power or a non-toric soft contact, usually about a week is fine. If you happen to have astigmatism power, we recommend about 2 weeks. And if you have a rigid lens or a scleral or hybrid lens, we recommend about 3 weeks out of contacts if possible. Now, of course, some people may not be able to do that, so we'll do the best we can in those situations. But in general, the more time without contact lenses in the eye, the more stable the refraction and corneal measurements are, which results in better surgical outcomes. Another consideration is the age. So keep in mind that most refractive surgeries are approved between 18 and 21 or up, but as you hit your 40s and 50s, be aware that refractive surgery may not correct all your needs, and that's because of presbyopia. If you're over 40 or 45, you may see well at distance with glasses or contacts, but you may need some help up close. So that means that most refractive surgical options won't be able to treat both distance and reading in those patients. This is a more complicated discussion, and we'll talk about this in other videos. But presbyopia, while it can be treated with refractive surgery, may not be a perfect option for everyone. Sometimes we have to target one eye for distance and one eye for reading in those patients, and that can be a little difficult for some patients to adjust to, and certain professions, it might not be possible at all. So be aware of that, and just understand that for patients over 40 or 45, your typical LASIK discussion might be a little bit more complicated. And the last important consideration is the lifestyle that you have. If you're someone who constantly rubs their eyes or has poorly controlled allergies or does martial arts or a professional football player where injury to the eye might be unavoidable, then refractive surgery may not be the best bet. Now, there are some alternatives. For example, PRK versus LASIK might be safer in some of those patients, but these are all things to think about before you go in for refractive surgery. So I hope that helped kind of outline some yellow and red flags that you might want to consider before you go in for refractive surgery, so that if the doctor says, well, you might not be a perfect candidate, this is why, that you understand that that is in fact the case. And if there might be something you can do to fix those issues before you consider surgery again. But as I've said before, refractive surgery is a wonderful treatment for many, many patients, but it is important to be aware that it's not a solution for all patients, and that you really need to understand that you and the doctor need to both be on the same page to pursue any surgical procedure on the eye or elsewhere in the body, so that you know what to expect. So thanks again for your time, and I will see you in the next video.